Let's talk about ergonomics. To recall, let's look at what ergonomics actually is. Ergonomics is the science of studying people at work and then designing tasks, jobs, information, tools, equipment, facilities, and the working environment so that people can be safe and healthy, effective, productive, and comfortable. Musculoskeletal injuries are injuries or disorders of tendons, ligaments, blood vessels, and basically anything related to soft tissue. Work-related musculoskeletal disorders are conditions in which the work environment and performance of work contribute significantly to the condition. Exposure to risk factors such as awkward posture, repetitive motions, and forceful exertions will basically be commonly found in the workplace. Most frequently reported injuries can be considered acute injuries. This is when, for example, you get a fracture, a cut, or a bruise. These injuries can affect any part of the body, including internal organs. On the other hand, we have cumulative injuries, and these would be injuries that occur over time. The physical effect of MSIs range from minor discomfort to disability. Symptoms are not always confined to the injury site. This means that symptoms aren't always restricted to one singular area. Pain is the most common symptom, and some other symptoms that you can see are here included on the slide. This would be tenderness, weakness, tingling, disturbed sleep, swelling, numbness, pain, unreasonable fatigue, and difficulty performing tasks or moving specific parts of the body. A sign of MSI is actually something you can see visibly, and a symptom is something that is usually felt. If you are experiencing any of these signs or symptoms, it's important to notify a supervisor as soon as possible. There are actually three main stages to an MSI injury. The first one would be mild discomfort. This would be present while working, but then it would disappear while you're not working. It doesn't usually affect work or daily living tasks, and it is completely reversible. The second one would be pain present while working. This is where it may continue when not working. It may be taking pain medication to stop this pain. It could affect work and daily living tasks, and it's still completely reversible. And the third one we have is pain is present at all times. This is when your work is affected. You may not be able to complete simple daily tasks, and it may not be reversible, but you are able to improve it. Here you can see that there are three main risk factors of MSIs. The first one would be force, the second being posture. So this would be awkward or static posture. And the third would be repetition.